All right, guys, so I want to make this video basically going ingredient by ingredient on both our products, IRE and our new K2 and D3 product, just discussing heart health, how IRE helps with heart health, how K2 D3 helps with heart health, just breaking down the mechanisms by how they do so, and how taking these two products together will kind of synergize that effect on heart health, so why it's important to take both of them together. So first off, let's take a look at IRE, and there are quite a few of the major heart health ingredients in IRE. So I'm not going to go over all the ingredients in IRE. This is just the ones that focus on heart health. So number one, which is a big one, is Arjuna bark extract. There are plenty of studies for Arjuna. Arjuna has been used by civilizations for thousands of years for its medicinal properties. But the gist of Arjuna is that it strengthens cardiac muscle, improves circulation of blood through the coronary arteries, and also can prevent heart muscle from ischemic damage. The main component of Arjuna that's responsible for these heart health benefits is arginoic acid. So if you look on the label of IRE, you can see that our Arjuna bark extract is standardized to contain a high amount of arginoic acid. You can look up plenty of studies on arginoic acid. You can see all the kind of heart health benefits that stem from that particular compound. So if you are using Arjuna, of course, it's important to have one that is as high in arginoic acid content as you can get it. So the next ingredient on the list for IRE is bergamot extract. So what's responsible in bergamot extract for these heart health benefits are the flavone molecules. These are compounds also present in other citrus fruits. It's kind of characteristic of citrus fruits that also have been linked to heart health benefits. So bergamot isn't completely unique in that aspect, though it does have a high amount of flavones. So what bergamot does mainly is that it's able to reduce LDL and triglycerides, as well as increasing HDL. So lower HDL is associated with heart disease and complications, and high LDL and triglycerides are, of course, also associated with heart disease and complications. So next on the list is resveratrol. Resveratrol is a polyphenol compound, which there are a few of. Polyphenols generally are known for their antioxidant and anti-inflammatory benefits. So for resveratrol, it lowers inflammation, it lowers cholesterol, the LDL and triglycerides via antioxidant pathways, and can also lower the chances of blood clots. There are some studies on that particular aspect out there for resveratrol. So next on the list is curcumin. This is what I would personally say is the biggest one, assuming you have a highly bioavailable form of curcumin, which we do. I've gone over this plenty of times with Longvita for IRE. Plenty of videos on that from me if you want to check those out. But curcumin is also a polyphenol compound. There are many antioxidant and anti-inflammatory properties of curcumin. Also have a blog on this on leviathannutrition.com, kind of with a chart going over all those antioxidant and anti-inflammatory pathways. So curcumin also lowers oxidative stress. Curcumin is also a little bit unique compared to resveratrol, that it increases nitric oxide production. This can dilate and relax blood vessels, which will help control blood pressure and just result in better blood flow also. And another component to reducing blood pressure is that curcumin can reduce receptor binding for angiotensin, which helps control blood pressure. Angiotensin binding to its receptor is what causes the constriction of blood vessels. So that's why you have prescription medicines that basically their function is to prevent the angiotensin binding. So right here, curcumin is able to reduce that to some extent also, and thereby reducing blood pressure in that mechanism. So I also have a YouTube video discussing the kidneys and how angiotensin binding contributes to blood pressure on the Leviathan Nutrition YouTube. You can, of course, check that out if you want to check out more, go in depth in this topic and how exactly that works. So again, curcumin is also well known for reducing chronic inflammation. This is referring to the heart, but there's also plenty of joint benefits too for a highly bioavailable form of curcumin. and of course can prevent and reduce heart enlargement. This is a pretty big issue, unique to curcumin, which can be a common issue in long-term PED use. So especially for bodybuilders, you know, it is important to be taking some form of curcumin just for this characteristic benefit right there. Curcumin also reduces lipid accumulation on the aortic endothelium and also can boost arterial structure and function. Okay, so that's kind of the gist for IRE. And now for our K2 and D3 components. So basically for K2 and D3, the main benefits will be the following. There'll be arterial health, decalcification of those arteries, and also bone and mineral balance. But in this video, we're more concerned with the heart benefits. So there's a thing called matrix GLA protein. This is abbreviated as MGP. And MGP is a member of a vitamin K2 dependent family of proteins that is able to bind to calcium ions. So MGP is directly linked in studies to arterial decalcification. In order to summarize, basically the higher the MGP content, the higher the rate of decalcification of those arteries is. And that, of course, reduces arterial thickening and stiffening. So what studies show is that consuming vitamin D3 increases the production of this matrix GLA protein, MGP. But there's also one catch to this. So in order for MGP to be able to have those decalcification properties, the molecule has to be in the carboxylated form. I'm not going to go into the chemistry of how the carboxylation takes place here, but basically the presence of vitamin K2 is able to convert MGP into this carboxylated form. And now that MGP protein is able to go and exert its decalcification effects on the arteries. So there are clinical studies showing carboxylated MGP and higher rate of decalcification and higher supplementation of vitamin K2 in the MQ7, the mainaquinone 7 form, which I talked about. This is the most bioavailable form of vitamin K2. Another common one is MQ4, which is less bioavailable, and of course it's cheaper. That's why a lot of products have it. So you want the the MK7 form. So of course, higher supplementation of the MK7 form of vitamin K2 is able to produce more carboxylated MGP. So that's why we have this MK7 form in our product at a much higher dose than you're used to seeing, because we really want to maximize this carboxylated MGP effect. Okay, so that's kind of the details of everything, going ingredient by ingredient. So now I'll just kind of give a summary of each product and the main focus of that. So for K2D3, the focus is more on the arteries, improving arterial function by reducing calcification and plaque buildup. You can get a calcium score done. That is the name of the test that kind of measures the amount of plaque buildup that you have in the heart. So, you could, if you do that, you have a high amount of plaque buildup. I would highly recommend that you take K2 and D3 because that's specifically what this product can help with. And of course, this is not a normal blood test. You have to specifically go and ask for a calcium score. It's not done through blood testing. Just throwing that out there. So reducing thickening and stiffening of the coronary arteries by with K2 and D3. So these effects on artery function can basically relieve symptoms of atherosclerosis and heart disease. So now for IRE. IRE focuses more directly on the heart by different mechanisms like reducing inflammation, reducing heart enlargement, strengthening the cardiac muscle, which of course can be very important after something like a heart attack, improving the blood flow and controlling blood pressure. So you have both of these effects on the arterial aspect from the K2 and D3, and then you have the heart-centric effects of IRE that both kind of synergize together to bring overall beneficial heart function with these two products.